All right, welcome to another episode where today we get to speak with Dr. Selena Mitchell, who is a licensed acupuncturist and doctor of Chinese medicine or Oriental medicine. And so today what we're going to be covering is brain fog, increasing mental cognition, vibrancy of the mind and body, and we are very fortunate to have her on. She has a bachelor's in psychology, a doctorate inside of acupuncture and Chinese medicine. She worked as an editor-in-chief in the California Journal of Oriental Medicine, and she also served on the board of acupuncturists for the California State Oriental Medical Association. So, Dr. Mitchell, thank you so much for joining us today, and I'm really looking forward to diving into all the wisdom that you're going to be dropping. So, I guess I just want to just dive right into it, if we could, for somebody to dedicate their life to a single purpose and a single mission like you have in helping people. I mean, that comes from a really deep place, and I would love it if you could just kind of share a little bit of your story and like what got you to commit to such an amazing adventure that you're on.
Yeah, good question. I think sometimes life paths find us, so even though there probably are inclinations related to maybe my personality or my upbringing, for sure, I was lucky and exposed to Chinese medicine early. My parents were both proponents of kind of Zen way of thinking, and I grew up in San Francisco in an area where there's a lot of acupuncturists around, so it was just kind of a household word and something that we utilized. And as a teenager, I worked one summer with an acupuncturist in my neighborhood as an assistant, and it completely opened my eyes. It was before I left for college, so that kind of gave me the inside scoop on just sort of what was going on behind the scenes in a clinic, and gave me the idea of that could be a profession. And it fit. I've always been interested in psychology and how humans work and what makes us, what's consciousness about, and healthcare. I come from a family of physicians and nurses and healers of different kinds. So anyways, it seemed like a natural path. So I went into college and studied psychology, but had this little background inkling of wanting to study Chinese medicine, and actually jumped right into graduate school out of undergrad in Chinese medicine. I was 22, so I was super immature and young and figuring things out, but it was a great start. And then from there, studied for 4 years and got my master's, and then began practicing. And that was over 20 years ago, and got my doctorate fairly recently, which is kind of a new advent within the field. At the time I went to school, a master's was the only that was the terminal degree. And then to become licensed in California, each state has its own licensure and educational path. And California, one of the more rigorous, as it is for many disciplines like lawyers and nurses. And to be licensed in California, you kind of have to study in California. So I did my training here and in the state, and it's been a wonderful journey. I'm still learning.
Well, so I'm curious, because as you've gone through this path, and it sounds like you've really been dedicated to understanding how to create wellness. From your perspective, what is it that's so important about people finding wellness today? I mean, I know that's kind of an open-ended question. I guess what I'm really seeking is, from your perspective, why is wellness so important?
Well, I kind of believe in kind of a grandiose way that each of us are responsible for our own centeredness and well-being and inner peace, and that affects the greater good. So if each of us can contribute to, a drop in the ocean of inner peace, perhaps world peace is possible. So it's very much, that gives us some control over the big picture if we can take care of ourselves. And
totally,
listening to our bodies and listening to what our unconscious minds are saying, what our physical selves are telling us. That's not always easy. As humans, we tend to distract and want to find comfort in an immediate sense and look for immediate gratification. But really listening is challenging. And I think that's the path to health and balance is routinely trying to listen, do our best to listen.
That when I hear you say that, and then when I think about talking to doctors who work with, like Western medicine, I don't know if I know that there are definitely some out there who have that viewpoint, but as far as it being built into that type of medicine, like that's not even something that they cover in medical school within the United States.
Right. I think more and more recently graduated physicians who I have some contact with, or younger physicians in general, are more open. And there are some exceptions, of course. There are older people that are open. But as a whole, I think the new generation of physicians coming out are really interested in, because I think we're learning more and more about human beings and recognizing that we're so integrated, and it's not just these set of parts, but rather the whole is greater than the sum of all the parts. And that's pretty profound. It's neat to see how integrated medicine is becoming, and healthcare in general. Our understanding of the body, nutrition, meditation, those things are making their way into standard medicine now, which is so neat. It's great to see.
Yeah, I'm excited to see where, and I guess, I'm excited to see where this is going to end up in another 10 to 15 years. Because it seems like we're going through so much rapid change right now to see, this, I guess, where you started. Okay, well, I'm getting off track. What I would like to talk about, I guess, so with Chinese medicine, what would you say like the ethos or the spirit of Chinese medicine is?
Yeah, I would say balance, finding balance, getting to the root of an issue and finding balance. So we can express with all kinds of what we call branch symptoms or disease manifestations, but regardless of whether it's, asthma or migraine or insomnia or, there's a million expressions of illness, but getting to the deeper root cause is the biggest concern within Chinese medicine. And that's our job as practitioners, is to determine what the root causes are and treat at that level. And trying to find balance at that level, which in theory anyway, the branch symptoms, even if it's a myriad of things over time, should improve as we find balance at the deepest level. And what that means is kind of steeped in a lot of philosophy in Chinese medicine, but it does directly translate clinically into how people do from a balance perspective. So, we're kind of, in our culture, in the Western culture, rather extreme. We often move into all sugar-free living, or no gluten, or fat-free, or whatever the extreme is of the time, of the era, or lots of exercising and running marathons, or fasting, or we've got these real extreme measures that we take. Less is more, more is less. It's like very kind of intense. And Chinese medicine is really about this, what we call the Wu Wei, which is the middle path, and that's probably one of the hardest places to walk, because there's no firm, you're never directly in the middle of the middle path at all times. It's this dynamic process where you're kind of wavering and sort of there, real gray area. But finding balance is like a teeter-totter, like a seesaw, and attending to ourselves, listening, and trying to stay relatively in the state of balance is the ethos. I would say that's the basic premise.
I love that. That lights up so many thoughts inside my mind. I guess an image that I had when you were talking about finding that balance, Wu Wei, and you're like walking a tightrope. And right. I guess maybe, and correct me, maybe I'm wrong here, but the way that I kind of mentally saw what you do then is it's like you're giving people a balancing rod, so that walking that balanced path, it's much easier to stay in that center line.
Absolutely. That's a great analogy. Exactly. I often think of my job as being kind of a mirror, trying to listen intently so people feel heard, and then helping them tune into what is going on for themselves. And obviously there are things I do to assist, like with acupuncture and herbs and advice and things like that. But really it's about the patient tuning in and listening to what they need, and helping arm them with tools that they can take home and utilize on their own, but really listening to themselves about what are they hungry for, and how much sleep do they need, and when should they take a break from work and put their feet up, and those kinds of balancing acts, internal balancing acts and external balancing.
Well, when you said it seems like such a challenging thing from an outside perspective, when you say that when you work with somebody, it's to look at the symptoms and then to try to find the root cause, to narrow in on that. That's it seems completely different than, and I could be wrong, I'm not a physician, but it seems completely different than Western medicine. Once again, to just kind of show contrast here, is because what traditional medicine tries to do is to treat the symptoms using medications or lifestyle changes. And what you look at is you look at the symptoms and say, what is that telling me about the direct path? Not to get too far off topic, but when somebody comes with you with a symptom, to try to narrow in and find like the core or the root issue, it sounds like a totally overwhelming process. So is there like a guiding principle or some kind of a philosophy that you could relate to us when you're dealing with a symptom to try to find the root cause?
Absolutely. And that's where a lot of our training comes in, is that we're trained in pulse taking, which is really the flagstaff or the flagship or whatever it is of diagnostics in Chinese medicine. So pulse taking is a big art, and it's a long-term process of learning it. There are a lot of different pulse taking strategies within the field. So different practitioners might be trained differently in how to take the pulse, but that is an important one. Looking at the tongue is another important thing. The tongue is a map of the body in Chinese medicine from our perspective. So it represents different parts of the tongue, and the color and the shape and the coating and other factors play a role in helping us look internally. Chinese medicine developed, thousands of years ago, when it was taboo to touch the body and be too physically palpatory, as well as they didn't, have the internal understanding of our physiology. It was all in theory, not actually, there was no cadaver work as far as we know. So everything was taken care of through observation, and as limitedly as possible. Like, feeling the pulse was about as far as the touch would go, and then looking at the tongue was, a way of not being too invasive in looking at the body, but you could look at this one little medium and get a huge window into the body. And then talking with the patient, as well as, we don't talk about this as much, but like smelling the patient, looking at their overall, what we call shen, which is the spirit, looking at their skin, all kinds of things like that. But talking is also really important in getting a sense of the patient's understanding of their symptoms and experience and their tone of voice. There's lots of diagnostic measures that we're paying attention to when we're taking note of a patient, and they all help us to discern which organs are involved. So internally in Chinese medicine, which organ has many functions, and may be out of balance or imbalance, relatively speaking, to the other organs. So we're looking at the relationship between the organs. And the organs are reflected through meridians in the body. So the energy is flowing through our system on the outside, but coming from the inside. So we're doing quite a bit of observation. And we're trained for quite a while in school to discern. So it's not such a overwhelming process once one becomes trained and then experienced in it. Initially, my first few years of Chinese medicine school were completely overwhelming because it was so much information to be taking in. Yeah. But it's quite a system in and of itself. It's really an old system, so it has had a lot of time to develop and become very complex.
Huh. Wow, that blows my mind. There's so many different things that you're looking at and using, and then to incorporate all that information and try to find a path. Okay, so when you do, after meeting with somebody and going through the process of trying to understand where they're at and where they'd like to go, what are some of the tools or levers that you can pull using Chinese medicine?
Right. So there's quite a few, and different practitioners specialize in different areas. So, you may go to one practitioner and receive one treatment, and go to another practitioner and have a very different experience, even if they perceive the same diagnostic, with you, and the same treatment strategy, or same treatment principle, they may treat differently. Their modalities might be different. But acupuncture is a big part of it. So that's inserting needles in points that are on meridians that help move energy in the system. And again, there's a lot of different methods and schools of thought, so that can vary. Even in acupuncture treatment from practitioner to practitioner can vary greatly, but that's one measure. Herbalism is a really big part of our training. It's at least as important as acupuncture. And so we're trained in understanding, once we make a diagnosis for a patient, we'll have a treatment strategy and then create a formula of herbs. So herbs are rarely prescribed individually, but rather in a kind of a concert of formulas, or concert of herbs creating a formula. So they work in harmony together. So the herbal formula might be made up of anywhere between, say, 5 to 20 herbs, roughly. And each herb has its function and helps to create balance within particular organs and help to balance each other out. So if you have some herbs that are, say, really warm, you might counterbalance that with other herbs that are more cooling, so that there isn't any tendency to throw the body off balance. And a formula is really designed to each patient, it's kind of tailored to each patient, because in theory, every person is different. I mean, you could have 10 people with the same symptomology coming in, say they all come in with asthma, but underlying that will be very different imbalances. And so you can't give any one person the same formula for asthma because, as other people, because their imbalances may be very different and might actually create problems or be disruptive or, incongruent. Wow. So we really listen to a person's body and then create a formula specific to that person. Same is true with dietary therapy. So there's so each food in the system of our world could be equated to, what herbs do. So each food has energetically relevant properties and can medicinally treat the body in a more subtle way than herbs. But so diet, I give a lot of dietary recommendations to patients from a Chinese medicine perspective. We use moxibustion, which is an herb we burn over particular points in the body, and that helps direct energy as well.
I'm sorry, what was that called again? That you burn?
Moxibustion is an herb we burn. It's called aye. It's mugwort in Western. It's a Native American Indian herb called mugwort, but it's also a Chinese herb called aye. It falls in the blood invigorating category, but when it's used topically called moxibustion, there's a lot of different formations of moxibustion. It can be in a smokeless form, which looks a little bit like a cigar and is held over the body directly. Some people place moxibustion directly on the body and burn it. It's an herb that creates heat, that stimulates the chi and moves energy. The chi is a energy force in the body that we're trying to move around because it's thought to be either deficient or stagnant in the system. I feel like I'm giving you a lot of information without giving explanation, but moxibustion's another modality. And so jump in if I'm overwhelming you, but Tuina is it's a form of massage, which is like orthopedic. It's a little bit like chiropractic end of Chinese medicine. Qigong, Tai Chi, those kinds of things are all aspects within Chinese medicine. And there are others. There are other aspects of Chinese medicine, but those are the major modalities that people utilize.
So I'm going to try to, I guess, simplify. I'm trying to wrap my mind around it, and it sounds like, in a way, movement versus stagnation. So it sounds like movement to find balance, movement of energy from places where it's stuck. When it comes down to it, is Chinese medicine, is it focused on, energy or chi? Is that like kind of a core?
Totally. That's a basic principle. Exactly. Where the chi is in the body is very important in helping to redistribute it, like you said. So if there are areas of blockage or stagnation, helping to create movement in those areas. We have to be careful because there can also be what we call deficiencies. So maybe too little chi in certain places, and we don't want to disperse or move too much in those spots because it can be draining. It can deplete a person. So that's where we're having to be super careful when we're feeling pulse and making a diagnostic assessment, so we can identify what needs tonifying, so adding to what needs more chi. And chi is just one construct within many constructs within Chinese medicine, but it's a basic principle. And where to move, how to break up stagnation, how to unblock blockage and redistribute. So that's really, basic understanding of what we do.
Wow. Okay. There are so many questions that I want to ask you and directions that I would love to go.
Right.
Okay. So for the purpose of trying to keep this on track, when we started, I said that we were going to be talking about or trying to, I guess, move into the idea of cognition, vibrancy, and eliminating brain fog. And I do understand that from what you were saying earlier, like when you're mixing herbs, there's really no like one size that fits all. So I understand that this is probably kind of a broad things to go to. So when it comes to energy, it sounds like that's kind of one of the foundations, and I'll let you elaborate on that. Is it possible for somebody from the perspective of Chinese medicine, is it possible for somebody to be completely deficient, like fully in their system, or is it just that we have the same amount of energy, it's not flowing? I'm just curious about that.
Great question. Yeah, no, it is possible for people to be quite deficient. Sometimes it can manifest as looking hidden, because of maybe the way our bodies externalize things. But yes, so somebody who has maybe been battling chronic illness for a long, long time, or has been malnourished, or maybe quite elderly and not been well cared for, not gotten enough rest over many, many years, or adequate diet, for sure, qi can be, very deplete in people. And then we have to be super mindful and careful, conscientious about how much movement we utilize versus tonification. So it may be in a case like that, we work first on mostly tonifying over a long period of time to build up.
And I'm sorry, can you elaborate a little bit on tonifying and what that looks like?
Totally. Tonification is just basically adding to the body. And so qi is one of different aspects within the body. We also have things like blood and jing, and there are essences within the system that we are working on building and paying attention to what is deplete and what is not, what is excessive, what is stagnated. But yes, tonifying is basically building up in a proper way without overdoing it, helping to create helping to create ample qi so that a person can then function adequately and their organs can be functioning properly.
So if somebody was low then in qi or energy, and they were trying to build up, is going straight to exercise or movement, could that be detrimental for them?
Yeah, for sure. Especially if it's, I would say for sure. If we were in the act of tonifying a person with herbs and acupuncture and diet, and suggesting lifestyle changes like adequate rest and things like that, then gentle movements can be helpful, like Tai Chi. If you think about Tai Chi or restorative yoga, called Yin yoga, those things are involving movement, but it's based more in subtle movement and intention than it is like active cardiovascular, running or something like that. So gentle movement can help as we're tonifying so that it prevents stagnation, because if we're applying a person with a lot of tonification methods, we run the risk of creating stagnation because we're adding so much to the system. So gentle movement can be very helpful, but judiciously and carefully.
Wow. Okay. So when somebody comes in, and I know that this is very broad, so I'm just going to let you take this wherever seems most logical and sensible to you. When somebody comes in and says, "I am struggling with brain fog," what is it that a person should look at, or what direction do you think we should go?
Right. So brain fog is one branch symptom, so one sort of expression of deeper imbalance that can present among other things. And what we would do in our clinic, or my clinic, is I would look at other symptoms that went along with that to try to delineate what is the brain fog due to at a deeper level. So other symptoms would kind of flesh out, is it a deficiency-based situation or a more excessive-based situation? So in a simplistic way, and there's a lot of complexity to the potentials, but in the most simple way, there can be deficiency of qi, like you were saying, specifically usually of the digestive tract in Chinese medicine. So a person's been eating like poorly, a lot of raw foods. So raw foods are thought to stagnate the digestive tract in Chinese medicine. And that can sometimes be, I know, isn't that funny? It's counter to what a lot of Western thought is about, like eating a lot of salad, and a lot of raw veggies are supposed to be healthy, smoothies, things like that. Chinese medicine actually feels like those things can deplete what we call the spleen qi, which is the qi of the digestive tract, and create imbalance in the digestive tract. Basically, the digestive tract has to work really hard when you put a lot of raw and cold things in it, because Warm things are kind of like pre-digested. So if they go in warm and cooked and easy to digest, then our body doesn't have to work so hard to extract the nutrients. And if it's cold and raw things, it not only does it deplete the chi, but we also can't absorb it well. So it's like a double whammy. It really can, over time, create a lot of trouble. And that chi of the spleen, the deficient spleen chi, can cause brain fog.
Wow.
That's one of the actual signs of spleen chi deficiency, is having memory troubles and brain fog and cloudy thinking. But an excessive version of a deeper imbalance that might cause brain fog would be something that we call dampness. And dampness can be in and of itself an issue. It can be a product of eating things like a lot of dairy, sugar, wheat, cold and raw things like I mentioned. It's a little bit of a difficult idea to translate into Western terms because there isn't exactly dampness in our terminology, but the idea would be like phlegm or mucus. So having, some people call it candida in Western sort of naturopathic thinking. The idea of a lot of phlegm or mucus in our bodies, not just say respiratory wise, but throughout the system. And dampness can limit what we view it as is it's hard to translate in Western terms. It's hard to not sound too esoteric, but our theory is that the dampness rises and prevents the chi in the brain from functioning properly. It prevents the chi from flowing smoothly through our system. So our brains aren't getting adequate nutrients and free flowing chi, and the dampness kind of blocks that. So we want to keep dampness out of the system, and that's more of an excessive expression of what can happen.
Okay. Well, okay, so with dampness from cold and raw type, it sounds like diet plays a pretty significant role into that, because you mentioned for even the spleen, it was gut. So it seems like a lot of this has to do with the food that we're eating. So what would you, if somebody did have dampness and a spleen deficiency, what direction would you send that person?
Yeah, and it's a good example of having kind of a multitude of things happening at once, because you'll have this chi deficiency underlying. So that's at the deepest level, causing the dampness. So the dampness can be a product of that, which is considered sort of excessive, but really it's got this deficiency base. So there's sort of a dichotomy to what you're underlyingly expressing, right? This dampness is excess, and then chi deficiency is a deficiency. So the two play a role together, and one is a product of the other. And it's a vicious cycle because they kind of compound each other. But if the patient came in with brain fog, I would determine how much of it is dampness and excessive, and how much of it is deficiency. Usually both are playing a role. But
can I ask you? Sorry, could I ask you a question? Okay, so if dampness was a significant issue in somebody's body, what would be some of the signs that, other than the symptom of brain fog, what would be some of the signs that was an issue for somebody?
Yeah, usually a person might feel like very heavy. Their limbs might feel very heavy. They might be having digestive issues with like diarrhea, things like that. They may have a lot of mucus, like obvious mucus, or yeast infections, things like that. Sometimes it can express as skin issues like eczema, other damp-like producing issues. Sometimes asthma can come into play. Insomnia can be a factor. But digestive issue is really not one of the number one expressors of dampness like that. So bloating, just digestive troubles in general, not digesting easily.
Yeah. Okay. And then how about, are there any obvious, like somebody who isn't trained, is there any obvious signs of spleen deficiency that you could say correlate with that?
Once again, so memory loss, brain fog would be a very key symptom in spleen deficiency, as would fatigue, digestive troubles, sometimes loose stools or diarrhea, heavy limbs. Those are all signs of spleen deficiency, bloating, trouble digesting food. Okay. So actually, chi deficiency and dampness are very similar, but the dampness tends to be a more extreme version of what we see with spleen deficiency. So there's usually some mucus involved and more blockage.
Right.
As the dampness.
So it's not like you just go from being I'm feeling good to dampness and spleen deficiency. There's like a range of severity.
Absolutely continuum, or it's a gradual process that can worsen and worsen. So if a person's living on sugar and having like very poor sleep and like eating a lot of damp producing foods, and stress can play a role certainly in most states of imbalance. So if you're under stressful conditions for long periods, in addition to eating raw and cold foods and things like that, then over time it can gradually develop and symptoms can get worse and worse. And usually dampness is kind of a more extreme case where spleen deficiency has been around for quite a while, and dampness begins to produce secondarily as a product of the deficiency.
Oh, okay. All right. Okay. And I'm sorry, I interrupted you. We were talking about so what direction you would take somebody who came in with that. And I had that thought and I jumped in and interrupted. But could we? Oh,
yeah.
Lost. Okay, there you are. I lost you for a second. Yeah.
You're asking the path that somebody would take?
Yes.
Indeed. Yes. So I would put somebody on a diet, plan that really attended to their spleen Qi deficiency, helping, them, encouraging them to have foods that help to stimulate the spleen Qi and help build the spleen Qi, protect the spleen Qi. So warm and cooked foods. There are particular foods that I would give them a list of to focus on, and things to avoid as well, like avoiding sugar and dairy and wheat and other ice water and ice cold things. Sleep and getting enough rest is a big part of that. So lifestyle, trying not to work too much, trying to find balance is a big factor.
So sleep, how does a person know when they're getting an adequate amount of rest?
It can vary from person to person, so there isn't any one number that's magical for everyone, but generally between 7 and 8 hours is a good rule of thumb. And then as long as you feel refreshed in the morning when you wake up, and then also if you were to, say, try to meditate, if you don't fall asleep, or if you're watching television and if you nod off during times like that, it can often indicate that you're sleep deprived. If you're chronically tired the day, that can be an indication of Qi deficiency, being tired, not getting enough rest. So yeah, it's hard. Our culture we're up against, a lot of unnatural light and computer screens and phone time and other things that disrupt naturally our biorhythms. So we have a tendency not to ease into rest as easily as our ancestors might have, because, it doesn't get dark at 5 p.m. It gets dark at whenever we turn out the light. So that may be midnight. And so we just our system isn't as we don't ease into things quite as easily. So sleep is a chronic issue for most people.
I know that most people are like, oh, don't tell me about sleep. I want to know the magic bullet to take care of the brain fog. But like there's this foundation that you're talking about, like this foundational thing that we can do, and that's to give our body enough rest. So if you were talking to somebody, like, I know that we just talked about a few things, but like, what are some specific tips that a person could do to make sure that they're getting adequate rest?
Well, good question. Yeah, I would suggest that they turn off screens and hide their phone, put it in another room, at least an hour before bed, ideally 2 hours. I know that's hard. Trying to make sure the room is cool. So being in a space that's not too warm and not too cold, but definitely in the direction of cooler is better. So not overheating your system. Trying to have regular sleep times. So going to bed at roughly the same time every night, preferably as many hours before midnight as possible. So in Chinese medicine, there's sort of a clock that represents different, what we call yin and yang balances throughout the day and night. And that's a whole other construct to discuss. It's the idea of yin and yang. But the yin is a restorative time for our bodies. And it's a time of darkness and going to bed before midnight. So ideally 9 or 10, getting as many hours before midnight as possible. That's our most restorative sleep time. And then trying to wake up at roughly the same time every day is also a good idea. So good sleep hygiene habits.
Okay. Okay. All right. So 2 hours before bed, make sure that the room is the right temperature, keep regular times. Put the phone away 2 hours before bed. Sorry about that. Regular times. And then, and then something else that you touched on was stress reduction. I mean, other than the what we're talking about with brain fog, when it comes to stress, are there any certain results or symptoms that you see as a result of people who are living a high stress, high anxiety type lifestyle?
Yeah, absolutely, because that can burn out our chi. So that can stress out all of our organs and create havoc through the system, and create blockage of chi in certain organs, like what we call the liver in Chinese medicine, which can indirectly then affect the spleen and lead to brain fog. So high intensity lifestyle. If you think about it, the idea of Chinese medicine views certain kinds of our chi. So each organ has a different kinds of chi. Some of the chi of our body is the chi that we're born with. And when we're born with, a certain amount of chi, it's like having a savings account. And if we're burning the candle at both ends and like working really hard and not sleeping enough over a long period of time, we're basically robbing our savings account to survive. We're using a chi that isn't natural to our system. It's not a chi that's restorable. So we basically deplete ourselves in a way that is irreversible. We can just protect the chi we're born with. We can't keep adding to it. So if we take from our savings account, for too long, over a long period of time, we end up with a deficiency, maybe even being in debt in terms of chi. And in some cases without ways to really restore it, except for the kinds of chi we can restore, which includes the spleen, the food we eat. So that's something we can routinely have control over, take care of, and add to. But there is chi that we might lose if we're depleting ourselves, living a very high intensity lifestyle that could leave us burnt out in a way that we can never restore.
That so when you're talking about that chi that we're born with, I started making connections, and I love that concept. I've never heard that or thought about it before. But this is a little off track, but does that kind of relate to our, like, the time span that our bodies are alive and vibrant on this earth? Is that kind of related to? So if you're robbing from that basic chi that can't be replenished, like, you're kind of robbing from, like, the time span that you're going to be here. Is that right?
Potentially, yes. I mean, it can impact lifespan for sure. It's the kidney chi is what I'm speaking of in terms of what we're born with, and the kidneys are the foundation of our congenital chi, or the chi that our parents give us. And there are factors out of our control, like how old were our parents when they had us, because that influences their chi and their reproductive chi, and influences the congenital chi that we're then born with, our kidney chi, how much we have and how healthy is it. So that's the kind of thing, like, it's kind of a gamble or a luck of the draw, like, how old were your parents? Well, you can't control that. And also, like, their nutritional well-being, their mental status, how healthy were they on, physically and mentally when they had you. And then how much nourishment did you get as a child? How much love and attention did you get? And then, how was your food? How was nutritionally? How good was your food? And how stressed were you? And things like that. All of that influences your congenital chi. But for sure, we do have a finite amount. So it can have lifespan. And certainly health of the period of time in which we're on this earth. So we might live a long time, but maybe not in the best of health, not as healthy as we could be if it were really protected and taken care of throughout our life.
Wow. Okay.
It's kind of intense. And we have to let ourselves off the hook, because we don't want to we are a product of our culture and what we're raised with, what we're taught. So we just do the best we can. So self-compassion is another big part of Chinese medicine. If we walk around feeling like, oh man, I'm doing, then that doesn't do us any good either. So we have to be kind to ourselves and realize we're all human. We're all doing the best we can. We keep learning and growing and trying to get enough rest, trying to eat relatively healthy, trying to maintain this lifestyle, stress-free as possible. Is our goal.
Yeah. Okay, so we touched on then getting proper sleep, addressing stress, and is there any other? And diet, moving away from anything that causes Dampness, if I'm saying that correctly. Are there any other major kind of realms that you would address with the human body in regards to brain fog?
Brain fog, I really think finding balance is the goal, and any one state of balance, finding balance is different from person to person. So some people may need more exercise than other people. Some people might need more rest than others. Nutritional recommendations would vary from person to person, but as a whole, I would say really listening to our bodies and tuning in, and that's maybe one of the hardest things. That would be the number one suggestion I would give people, is to really listen, and on a regular basis, to where their limits are, setting boundaries with various things like how much we eat, who we hang out with, what we do with our time, how much we work, how much we sleep.
I was talking to somebody who referred to it, they were talking about diet, and they're saying it's not just what you put in your mouth for your diet, but it's, exactly what you were just saying, is the people that you spend time with, the music that you listen to, all those sorts of things.
All those factors. Yeah, absolutely.
This isn't something that I prepped you for, and so I'm kind of throwing you a curveball here, but I'm feeling drawn to speak about this, and that's the whole issue of mental health and mental illness. With depression and anxiety, it really seems like we're at a time right now where it's definitely on the rise, and there's a lot of people struggling from that. And I think that brain fog, in a way, kind of ties into that in some capacity. And I'm just wondering if maybe you could just share your thoughts about mental illness today, and for the people who are watching this, who may feel like they're balancing on the edge of brain fog and possibly mental illness. Like, is there anything that you can say to them?
Good point. And I think you're right that people are struggling at a higher rate now, perhaps than in past years, past decades. I think this is a tough time globally for a lot of reasons. But it's very similar in this idea of treating just brain fog, when we specifically talked about that. Working on mental illness is really about finding balance on a deeper level, trying to get to the root of what might be going on a deeper level in terms of imbalance. A lot of Chinese medicine's viewpoint around mental illness relates to the health of the heart, and that is just one organ in the concert of all of our organs that is important to protect and take care of. And specific things we can do to help protect the heart include same things we mentioned before, adequate diet, proper balance of diet. There are some foods that are specific to helping the heart, but also rest, getting enough rest. Those are key things. Meditation play a big role in assisting a person in that realm. So it doesn't have to be long stretches of meditation. And in fact, it's a little like exercise. You wouldn't want to jump in and try to do a full hour. You have a lot of history of doing it, but doing 5-minute increments, and maybe working in a group with other people or with a teacher, but building up with meditation to help calm what we call our shen, which is the spirit of the heart, which plays a role in mental illness for a lot of people. And when we do things like meditate, other factors, other modalities like qigong, tai chi, or yoga, those kinds of types of physical activities that help quiet our bodies, help us to then listen to ourselves and get in touch with our bodies as well as our hearts and our minds. And in that process of tuning in, we have a tendency to better listen and know what we need. But learning to quiet the mind is a little bit like exercising, in that it's a thing we slowly build up, kind of like a muscle. So over time, we can get better and better at it. It certainly doesn't, I'm not suggesting that would cure all mental illness by any means. And there are conditions of various gradations of mental illness that need assistance by, for sure, from health professionals or mental health professionals. But meditation can be a nice medium in which to at least listen to our bodies and minds and better understand what it is that we specifically might need, because it does vary from person to person.
Thank you. I never heard about the correlation to the heart. That's very interesting on a lot of levels.
Absolutely. Yeah. Western physiology has recently scientifically proven a relationship between heart health and mental illness, as well as gut health and digestive tract and mental illness,
Yeah.
or mental well-being. So it's neat to see that we're now validating some of the Chinese medicine's understandings of the body that have been in existence for quite a long time.
Yeah.
And yeah, heart is a big part of it. And it just ties in with all the other organs. So any one organ is not independent of the rest of them. And the health of all of our organs is important to pay attention to. But the heart specifically is related to mental illness in a direct way.
I'm curious, can acupuncture, all these things that we've been speaking about in terms directly to brain fog, can acupuncture done by somebody like you, can that address those specific issues?
Absolutely. No, absolutely. And that's part of why people come in on a regular basis. So depending on the issue that they're concerned about, or whatever branch symptoms are causing distress or trouble for a person, which might bring them into the clinic, say brain fog or some form of mental illness like depression or insomnia or something along those lines, acupuncture definitely assists, oftentimes, not for everybody, but for many people, in basically redistributing the qi, helping to build the qi in the right places, helping to redirect things.
Mm-hmm.
So it can be quite helpful, especially when done with these other modalities like diet and herbalism and exercise, lifestyle suggestions.
So like, I'm not familiar with acupuncture on on a one-on-one basis. I've never had it done. I'm interested in having it done. And if I lived closer to you, I would come visit.
Anytime, sure.
When it comes to acupuncture, like, how often is that? I mean, like how does somebody incorporate it into that life? What should they expect?
Good question. And how often a person gets acupuncture is very much dependent on the individual's state of imbalance. So there isn't any one remedy or recommendation for every person across the board. Oftentimes, if people are suffering from chronic illness, I'll suggest that they come in several times a week for maybe a month. And from there, we assess how they're doing, feel their pulse and tongue, talk about their symptoms each time they come in, and navigate from there. So some people may respond really quickly and graduate to not needing many treatments at all, maybe once a month or something like that. And some people may need ongoing treatment for many months before there's a real obvious reaction of positivity. So there's both treating things acutely and intensely, and then there's treating things over a long-term chronic, state, and that can vary. A lot of times, acupuncture really works best in prevention. So once we find that we bring a person into a relative state of balance and their concerning symptoms are improved or dissipated or relieved, then we might work towards prevention. So if somebody comes in with brain fog, we reach a place of they're doing better, they're hardly experiencing it all or not experiencing it, then we work a maintenance program out where they may come in every 3 months or something to keep things balanced, kind of like a tune-up for your car, where keeping things flowing properly. So working preventively rather than working like putting fires out after they're started, but instead preventing them from happening.
Okay. So I know that we're nearing the end of our time here, and there's just a few more questions that I'd like to ask you. And one of them, this is kind of a broad ranging, I'm going to kind of lump these two concepts together. One of them is people who are dealing with issues, whatever they may be, and they come visit you, and they have a stack of pharmaceutical drugs that they're taking to manage the symptoms. How does somebody address that issue? And then the other side of that I wanted to bring in is, people who try to supplement, like brain fog, they try to supplement or help themselves through things like caffeine or nootropics or something like that. So I guess what I'm asking is, these outside sources that people are reaching for to try to find balance, how do we move away from that? And I guess anything that comes to mind when I talk about that.
Right. Good question. Yeah. And we have to practice. So practicing Chinese medicine in this day and age means working with people where they're at, where in this, what is the world in which they're living at this time. And so usually, very frequently people I see are taking pharmaceuticals as well as supplements of some form from other practitioners. And my rule of thumb is really, first of all, legally, I can't step in and advise them with pharmaceuticals. So I need to defer to their medical doctor or osteopathic doctor or whoever they're seeing that can. And usually I'll reach out to those practitioners and talk to them about what they're prescribing, especially if there's potential side effects that might be contributing, because sometimes there are side effects to Western pharmaceuticals that might be causing brain fog or at least exacerbating it. Not that they should necessarily eliminate those pharmaceuticals or stop, reduce them, but rather just be conscious of it so they know, it might be caused by this, and what are our alternatives, or accepting that that's a symptom they have to put up with to treat something much more important that needs remedying. So it is very case by case in terms of how to handle people's supplements and pharmaceuticals that they might be taking. Some cases, if the goal of the patient is to modify, then we'll talk with their medical doctor or osteopathic doctor about if that's an option, and if so, how we go about doing that. Okay. We have to work with what a person is utilizing and taking, but it can be a factor. It can sometimes be a contributory factor, an exacerbator of the situation, or a side effect. So we have to take that into account.
Okay. And then as far as the side of like the caffeine or the nootropics and that sort of thing, is somebody is is it going to inhibit, like, is it going to slow them down from recovering from brain fog? Or maybe you can't answer that because it's in the person.
It very much depends on the person. It's true, but it is an important factor. So if somebody's plying themselves with caffeine and feels they need to, it usually indicates that they're tired and their brain fog is so extreme that it's self-medicating, or if they're taking other supplements that might be assisting them in a topical sort of way. But what we want to do is pay attention to is that just being a symptom and not working on the deeper imbalance. And in fact, sometimes that's disrupting the deeper imbalance. Like, for instance, lots of caffeine can deplete that savings account of chi that I mentioned. Over time, pulling from our savings account, it can worsen the problem. So we want to sort of address that, and usually I'll suggest a plan of reducing caffeine slowly and working on natural ways to build energy through diet and foods that might enhance the chi and give us energy in a more sustaining way without depleting ourselves. But it's very case by case. It depends very much on the person, the amount they're taking, what they're taking alongside it, the reasons for them taking it, things like that.
That's interesting. So then I guess just to kind of recap and pull this all together, when it comes to brain fog, and definitely correct me if I misstep here, when it comes to brain fog, it's brain fog is a result of an underlying system, and it goes back to exactly what you were saying. I think is basically the foundation is to find balance within a person's life, and whether that means the food that they're consuming, their awake rest times. I mean, everything. It comes back to balance, right?
Absolutely. Ultimately, that is easy to say, not always so easy to execute. But yeah, that's the goal. And even within that, we want to find balance in achieving balance, right? And that means it's tightrope walk, which is what you said, and that's a great term. Yeah. That's a great analogy.
Okay, so how can people? I mean, first of all, let people know where you work, and then how could people get in touch with you? What's the best way to connect with you?
Yes, very good. I'm in the Central Valley, so I'm in the middle of the state, Fresno, California, and I, run a clinic with a few other practitioners. Really enjoy my work, and I work full time doing acupuncture and Chinese medicine. Contacting me, looking at my website. My clinic is called the Lotus Center, and it's www.lotuschinesemedicine.com, and that's probably the best resource in which to find my contact information and get in touch with me if necessary, and questions are always welcome.
Great. Okay, and I'll leave a link for that down below in the description, so anybody that wants to grab it, feel free to head on over. And the final question that I would like to ask you is, if you could go back and visit the you from 10 years ago and give that version of yourself any sort of advice, what would that be?
Great question. And I give the advice I just gave earlier to the general populace, to myself, which is listen. And it's listening to our bodies, listening to our hearts, and listening to our minds is really not an easy thing to do, because sometimes then we're hearing what we don't want to hear or whatever. So listening. So I would have told myself to listen, And I, gradually have learned how to do that, but it's not something we easily do. I think we're designed as humans to kind of avoid listening so we can keep going and function and survive. And
totally.
So listening, I think, is the number one thing that we can do to take care of ourselves.
And I'm sorry, I have to ask though, if you could give one tip for learning how to listen, because that's a skill in itself.
Yes, right.
What would that be?
Absolutely. I think so. We could talk for another hour about that.
I know.
How to listen, right? But for me personally, the best thing I can do is separate myself from, say, any situation where there's lots of noise, whether it's other people's feelings and thoughts and opinions, which I think value highly, but tend to absorb. So for me, like taking a walk or meditating, taking a little time out is the best way to listen. Involving myself in physical activity like yoga, qigong, taking walks again is a method of sometimes engaging ourselves physically without it being too vigorous, but just enough to help to wake our bodies up so our symptoms come forward and our bodies can kind of be engaged. That is another way of listening.
Beautiful. Dr. Mitchell, this has been amazing, and I could definitely speak to you for hours and hours.
I feel the same way.
I really enjoyed this. So thank you so much. You guys, make sure you reach out, connect with Dr. Mitchell, and we'll see you in the next episode. Oh, is there anything that you would like to say to the audience before we go?
Well, just take care of yourselves and continuing to listen and finding balance. That's the goal for 2020. Here we are, 2020.
Yes.
Take care of yourselves. Absolutely. Thank you, Nate.
All right. See you guys.
Take care.